This interview is going to be with Dr. Fanny Hawkins, a professor at TSU, and it's for the sports psychology class that is taught by Dr. Reynolds. And I would like to start off with asking you about your education background, and I would like to know a little about the junior high school, the high school that you attended.
Again, I am Dr. Fanny C. Hawkins, and I am a health information management professional. Been practicing for the last 30 years. So I started back in 1989 at Texas Southern University. So I've been here a little over 30 years. So let me take you back into my early education, and that was at G.W. Hamilton Elementary School. That was at Franklin Junior High School, and then Franklin Senior High School. From there, I went about 50 miles from home to the University of Southwestern Louisiana. It is now called UL, University of Louisiana. And there I majored in what was called at that time medical records. That profession has transformed into what is now called health information management. From there, I went to Texas Southern University and did a master's in public administration and a doctorate in higher education administration. And from there, I did a postdoc in health informatics at the University of Texas here in Houston, the Health Science Center. That degree in informatics kind of merges together paper medical records and electronic health records and everything in between there. So when we say health informatics, we mean we've now transformed that paper environment into an electronic environment. So that includes electronic health records. Everything in healthcare has basically gone from a paper environment to a what we would consider now an electronic environment. So you have informatics in both, not just data, but you also have health informatics in pharmacy and nursing, and there's also informatics for physicians. So I am currently teaching here at Texas Southern University in the Bachelor of Science degree program in Health Information Management, and we are a part of the College of Pharmacy and Health Sciences.
Who were some of the people that impact you in your journey along the way?
Early on, I would have to, give a lot of that to my parents. They were not educated, but they clearly understood the concept that their children needed to go to college. So it was understood that I was going to college no matter what I majored in.
Oh.
And then after I got here in Houston, I would say some of the people in the College of Education actually impacted some of the things I'm doing, like Dr. Lillian Potes, Dr. James Cunningham. All of those had taught me and then had hands on in terms of where I was going with my career. So yes, some locals have some input there.
So I would like to ask you about the impact that you think that sports psychology might have in today.
Looking at some of the current events, like the LSU girls winning the championship, and
yes, ma'am,
those girls are making now, as opposed to them moving on to the WNBA now. They're making more money now in college than they would if they would now, as of today, transfer over to the WNBA. So from a psychological standpoint, and the students that I deal with, they see a lot of those athletes making a lot of money. And they understand that, if I could be an athlete, I can make this amount of money. So it's hard to keep them in school when they see athletes making that much money and they're trying to get a Bachelor of Science degree. So that, I think, has a lot, that says a lot in terms of the psychology of what sports is doing today to our young people.
How would the mental aspects of the sports industry change over the decade, has changed over the decade?
Here again, I would have to go back to some of what's going on in the news right now with the young ladies winning the championship. Look at their, even the incident where the young lady did some of the same hand gestures as the other young lady did. And then the public didn't see that as the same. So mentally, I think what we see on TV has a lot to do with how we're raising our kids or where those kids are going and what they want to do with their lives. So I would say sports and sports medicine and sports mentally and sports in general has a lot to do with our everyday lives.
Dr. Hawkins, I will be bringing this to a close, but I have really enjoyed this little short interview. It was, if it looked like we was going to hardly get together, but we made it. We made it, and I am so proud. I really thank you for this golden opportunity to let me interview you.